This is called the 4-point cat camel, followed by up dog and down dog, designed to help counterbalance lower cross syndromes as well as longitudinal posterior and anterior lines of the fascial system. So when you're doing this, it's really important that you, first of all, stabilize the shoulders. So screw the elbows towards one another, plant the hands firmly on the ground so you feel like you have pressure on the inside, outside, and just below the fingers. Just like a foot tripod, you have a hand tripod. Lock the shoulders down, get into a neutral spine to start, and then from this position, when you breathe, it's going to be inhale, draw in, and then when you do so, you got to be very careful about it. And then inhale, look up, exhale, draw the belly button in, and when you do so, really try and focus on drawing from the lumbar spine versus the thoracic spine. Inhale, look up, and really focus on compressing through the thoracic spine, and then here, now this time, really draw through the belly. Exhale, inhale, drop the shoulders, exhale. And then by changing the emphasis into the lumbar spine during flexion and the thoracic spine during the extension pattern, it'll really help overcome lower cross syndrome. Then we get up dog and down dog. So while I'm not an expert in these movement patterns, it's important that they're performed in order to improve range of motion in the frontal and posterior lines. Okay, so anterior and posterior lines. So for what we're going to do is a modification up. So the down dog is very straightforward. You press up and back. You compress the shoulders and try and let your chest fall towards the floor. Get your heels as close to the ground as you possibly can. And then from here, we're just going to add a simple modification. You're going to walk the heel. 1, 2, 3. Push the right heel into the ground. Keep the shoulders compressed. 1, 2, 3. Press the left heel into the ground and create as much line strength and flexibility as possible. And then the second portion of this is to strengthen that line. Okay, so what we're going to do, we're going to strengthen that line, and then that by reciprocation, open up the front line. So we're going to do an assisted back extension exercise specifically designed to increase thoracic spine strength. So you're going to squeeze your glutes, hands are under the shoulders, drop your shoulders away from the ears, very important. Point your toes as much as possible, fire your glutes so you're pressing hard into the ground, compress the shoulders, and then what you're going to do is press up with the hands, keep your chin tucked in, lift as far as you can, keeping the elbows in nice and strong, and then you lift the hands off the ground. And you hold. 3, 4, and then you lower back down again. Reset. Press up, keep the chin tucked in, keep the shoulders down, lift the hands off the ground, and use your back strength to stay up there. Next we're going to continue down the posterior line, the longitudinal posterior line, tying in aspects of it laterally and then bringing in the lateral lines. We're going to do mobility and stability of the lateral line. So activation and mobilization of that line. So what we're going to do is called 10 and 2 o'clock child's pose. So you sit your bum down to your heels. You can use wider leg position if you like. Sit your bum down, reach your arms out so that they're flat. You can turn the hands up if you like. From this position, wiggle your shoulders just a little bit, a couple times just to stretch the lat a little bit per side. And then walk your hands over. Keep your heel against your butt in the direction opposite of the hand walk. It's really important. Walk the hands over, get the head between the arms. Feel it stretch down the right hand side of the body. Breathe through this for a 2 to 4 count and then walk back through. Keep your heel down. Again, direction opposite. Keep the heel against the butt. Let the arm lengthen. Keep the head down. And from there. So that's mobilizing that lateral line as well as the posterior line. Then you're going to do what's called a Jane Fonda. It's not on your list. Your leg goes straight. This is part of the assessment for this line. Leg straight. Toes up in a dorsiflexion position. Leg unbent, so full knee extension. Other legs brought up into a flex position in line with the thigh. From this position, the hands on the top hip. Elbow strong position. Try not to let yourself sag, so it's really important to stay up and engaged so you can even push your elbow into the ground. Just hold the shoulder stability, and then all you have to do is lift that heel off the ground, but keep everything absolutely straight. Hold for 2 to 4 seconds, lower back down and repeat. That's called the Jane Fonda. That puts stability and strength into that lateral line. Last two movements tie in a lot of the different fascial lines and assessment pieces that are in the functional movement assessment. But we're going to start off with what I call the kneeling straight groin stretch, so straight leg groin stretch with hip shifts. So what you do is you outreach one leg, make sure the foot's absolutely straight ahead. The hands are in line with the bent knee, and then in line with basically sort of in the middle of the position. So from here, elbows in, back is relatively flat, toes dorsiflexed on that back foot, this foot straight ahead. And just shift forward and backwards, placing your weight mostly to your hands and then mostly to your knees. Good, and this opens up, you're going to feel a distinct adductor stretch. We're mobilizing the hip, we're stretching the lower back, we're creating some stability in the shoulders as well. To increase that stretch, what we do is we internally rotate the bent knee leg. So you flatten the toe, you internally rotate it, you reach over into this position, and now what you do is you add the foot turn ins and outs. So the focus is back to neutral and then out into internal rotation. Keep your back flat. If you have great flexibility, you can reach all the way over to this leg, and it's going to increase the stretch in the hamstring and the groin. That's part 2 of that stretch. The last stretch is called the 3-way hip flexor. So with the 3-way hip flexor, we set up in 3 different positions. So the foundation position is the hip flexor stretch. A lot of people arch their back. It's really important to stay neutral in the spine and shift forward out of the hips to get true hip mobility or hip extension. From this position, now we're going to add in 3 to 4 movements. So I'm actually going to do 4 for you. So the first one is going to be a side bend. Use the opposite arm to the leg that's forward. You drive it up while the other hand presses down. So you press and you side bend. So we're tying in aspects of the lateral line and portions of the psoas, the lateral aspects of the psoas. We come back to center. We grab our hands, we clasp them, we press the arms along, we decompress the shoulders down, we make sure we're staying neutral, and then we rotate everything straight and strong. Don't lose your arms. It's important to keep your arms in line with your ears and keep a nice upright torso as you're doing so. You can still stay in the hip flexor dominant position. Part 3 is going to be a hamstring stretch. What you do is slide back, you dorsiflex your toes and attempt to straighten your legs and attempt to bring your nose towards your knee. If it's too hard, you undorsiflex the foot. And then part 4 of this pattern, what we can do is a quad stretch, and this is a little bit more advanced, okay? So, or various other things, but the quad stretch brings you forward. You reach down with the opposite arm to the leg that's forward. You press, you make sure your knee's tracking over that toe. You open up in the shoulder, and you slide forward. So it's quad stretch and open up. If you're not flexible enough for that, what you do is you reach across the knee, keep the shoulder strong, and you pull yourself into rotation as an option, and be sort of more of the adductor dominant as you knuckles to knee, wrist first, so mobilize the wrist, compress the shoulders, and track it around. And as you do so, slide forward into the hip flexion. Good. That's your core activation muscle and balance poster. When you come to nashFIT, I'll relate it to all the different assessments that we do, and it'll make sense for you in terms of helping your clients remove muscle imbalances.